Luz Chavez. I'm an occupational therapist here at VibraLife, and I just wanted to spend a few moments and talk about stroke rehab. Obviously, that's so critical to try to get our patients as soon as possible after they've had the stroke. Our first approach will be to try to rehabilitate what they've lost, meaning we're going to try to regain anything that they may have lost in strength, in balance, coordination, cognition, all those different areas. And if for some reason the stroke is too severe or we have obstacles that would hinder that approach from being successful, then we go through a compensatory approach, meaning how can we get them to be as independent as possible using strategies within self, within the environment, things like that. So that's something that I take pride here at VibraLife. We have a very great team that we work well together for OT, PT, and speech. And I just want to introduce to you one of the things that we do use. It's called the BITS, and we have the different disciplines here. And it's really, really great for anybody who's had any kind of neurological deficit and even weakness. And it's very, very extensive to the type of patients we can use this for. But specifically for stroke, one of the things that I just wanted to show you, we have visual scanning, we have visual pursuit, cognitive areas, visual motor, charts. These are just different activities or games that we can do in our therapy to make it a little bit more fun, but at the same time address some of the deficits our stroke patients may have. For example, this is one of my favorites, and they tend to like it as well. I won't go into detail here, but we can choose the different parameters according to what would be appropriate for our patients. And what we do is we have them scan the different numbers, okay? And they just start to pop them, and then they just start to look. So they're scanning as they would scanning the environment. They're looking on order. They're using their arms. Sometimes we can have them use their stronger side or maybe their weaker side. We can accommodate this so they can do it in sitting and standing. But again, this is just one of the areas that we use, but we also have different equipment here. So I hope that you would give us a chance. We would love to be able to provide occupational, physical, and speech therapy to your loved one. Thank you.
So my name is Jennifer Parada, and I'm the Assistant Director of Nursing here at VibraLife. Signs and symptoms that you should look out for are one-sided facial droop or facial numbness, speech difficulties such as slurred speech, and one-sided muscle weakness, which can include difficulty of movement with upper and or lower extremities. If you are experiencing any symptoms, please call for emergency care immediately. If your loved one is requiring recovery services, we are here to provide care.